Thank you for inviting me to present the development and overview of the clinical practice guidelines for EB. I'm Kattya Mayre-Chilton, and I'm actually the guideline coordinator for DEBRA International. What I'm going to try and cover today is actually going to be a little bit of a background. It's quite limited on time, so I'll try and be very brief. How we prioritize some of the subjects, where you can get the standards, how we develop the guidelines, some of the steps, access to the published guidelines, and also the sales cycle of the guidelines. So today, this afternoon, is really focused on guidelines. In the morning, we heard fantastic news about all the research. And it's really about thinking, in the morning, it was about the researchers and the clinicians getting together and also getting the participation from patients. In the case of the guidelines, it's also very important for people living with EB to be part of them. And I hope that through this presentation, you'll be able to engage with that. So DEBRA International has undertaken a long-term initiative to develop clinical practice guidelines for EB in order to improve the clinical care of people living with EB. It is unusual for the development of guidelines to be led by a patient organization, but in the case of rare diseases such as EB, it is unlikely that guidelines will be developed without the drive of patients. Despite being well placed to lead such an initiative, there has been major challenges that DEBRA has to address or had to address in the past in order to ensure the future success. So acknowledging some of the challenges, so historically we know that there's been loads of frustration about the lack of evidence, lack of knowledge of the methodology of doing guidelines, the time limitations of doing work as well as doing the guidelines, and funding in order to produce the guidelines. From the figures that you can see, or actually from a survey that was conducted a month ago. And it's actually showing that still the lack of evidence is actually a major problem still. It's very frustrating for most people involved in the guidelines. But the methodological experience is actually increasing and people are enjoying getting the knowledge of how to do the guidelines. We now also have a better understanding of how much time this is taken for different panel members and their different roles. So between 1 hour to half a day, depending on what your role is within a panel. We've been very fortunate this year that we have 7 guidelines have been funded. So again, focusing on the benefits of being part of a panel and developing the guidelines. In this survey that we've just conducted, 84% was completed by the people involved in the guideline over the last year, out of which 13% of these people were people living with EB. Most of these people are involved in more than one guideline, and they also want to be involved in other guidelines in the future. Majority of the people in the panel are obviously full panel members, and the majority of clinicians involved are actually general health and social clinicians. And just to highlight that the key things and benefits that have been highlighted by most clinicians has been the networking and building that network. Also learning the methodology of how to do the guidelines, learning new skills. There's all sorts of different computer skills that people are picking up. And also learning from others' experience has been a major thing that people have come up with. So some of the solutions that we put in place is obviously training. And I'm trying really hard to get other forms of training to carry on going and building a real network of people having the experience of doing guidelines. Also employing new models of developing the guidelines themselves, having a coordinator, and also employing or having project managers for guidelines. So the way forward is to understand the priorities, build a community, apply best practice, and a large dose of goodwill. So the priorities, we actually ran a survey last year, which we actually presented at Zagreb in the conference last year. So along the x-axis, we have the topic that we knew at that time by Easter of last year, of all the topics that people felt were important for us to have guidelines. The EB community voted, and along basically the red bars, it's indicating the most important topics for people. And as you can see, the highest levels of red bar, or most of those guidelines are actually being published, and a lot of the ones in the middle or the ones that are in development at present. We now have a list of 22 guidelines in development at different stages. And additional recommendations were to maximize the network. We now have more than 250 people involved and volunteered to be part of the guidelines. Most of these people have already committed to one or more guidelines. I have 133 volunteers working currently in 10 guidelines just this year, and we're covering nearly all continents. Out of which 25 or 90% are people living with EB, and they're living in 9 countries around the world, and they are full panel members. This is a diagram that actually comes from the GRADE methodology. It's a form of methodology to doing guidelines, but it's a nice diagram for you to see the steps that are involved in developing a guideline. So we've already talked about what the priorities are, and we know what the population is. So some of the initial decisions is what the clinical question is, and the PCOS refers to population, intervention, comparison, and outcomes. And I will touch again on that in following slides. Then it involves doing the searches, evaluating the evidence we have, building the recommendations, writing the article, getting peer-reviewed, getting feedback from everyone, and then publishing, disseminating it, implementing, evaluating use, and obviously reviewing the guideline. The guideline is as old as the literature that it's actually been involved in, so it does have a limited time span. Other recommendations were to do a standard. So we've actually built a standard that it's taken into account both grade and sign, but also the fact that it is a rare disease. Grade and sign methodologies look at guidelines in general conditions in the general public. And obviously people that, when you're working with rare disease, there are certain limitations that we need to consider. So we've actually got these standards, and you can download them from the DEBRA International website. Another thing that we're doing is the translation guidelines, the translation of the guidelines, and we got a standard for that as well. I'm delighted to say that DEBRA Spain is leading this and translating some of the guidelines into Spanish, and we've actually started with the wound care guideline, which is a review that was published this year. So hopefully we get that either by the end of this year or beginning of the next. Another link with Olivia. So Olivia Mullen, which is the business manager for DEBRA International, I work very closely with her in relation to the translation as well as the communication updates. So we try to communicate as much of the important business that we're doing and who we're linking with and what guidelines are being developed in order for people to get involved. It's another diagram, again, just to show that how the guidelines are developed and some of the steps. And again, it's from the GRADE methodology process. And as I mentioned before, you see the PCOS there. So generally, we have at present 4 guidelines that are starting at this stage in September. And this process will take around a year or slightly less in order for them to evaluate all the evidence that's available and to summarize it. At that period of time, they would meet together, the panel, and decide what the recommendation is. And then they will start on writing the guideline. And we at present have 3 groups that are at this particular stage. So all published guidelines need to be open access, published open access, so that you have accessibility to them to download anywhere in the world free of charge. And this is something that it's included within the funding that we've actually requested. At present, we have 4 guidelines, and you can access them from DEBRA International website. We got the oral health care, the wound care, cancer management, pain management. We also have the older versions of the wound care for both the UK and the Canada versions. And you can download them from there. An important thing is that guidelines also highlight what the gaps in knowledge are, and therefore highlight where research needs to happen in order for us to improve and to improve our guidelines in the future and improve the care. All guidelines should have a summary of the recommendations. So this is an example of the wound care guideline that was published this year, the review. And so all guidelines should have a table like this that indicates what the key recommendations are, what the strength of the recommendation is, the level of the evidence, so what quality of the evidence is available, and where that evidence came from. So when you're sitting with the clinician, you take all of this into account in order to make a decision together. Important thing, and I feel with the audience today, is the power of the patient. As a patient or as a person living with EB, there are different areas that are really important in the development of the guideline. Your presence and involvement in the guideline make them better standard and better evidence, and it's more relative and more important to what you need. So being involved in the panel, being involved in what the outcomes are, and really understanding what the priorities are to you, but also being involved in the dissemination and use of the guideline. The guidelines can be used in many ways. So as I said, the person living with EB can use the guideline either by making awareness. If they're going to see a clinician that has got very little awareness on EB, they can direct them to the website and say where they can access them from, or they can download them themselves and take it along. Some people have done this, for example, with the oral health care. If they've gone to a dentist that has got very little awareness about EB, this is what they have done. Again, it's also the health and social care professionals being aware, are they looking after someone that lives in isolation, that lives in an area that has very little access to other specialists with the knowledge of EB. And again, it's just sort of thinking ahead and sending the guideline or sending a link. We've noticed that they are really useful also in transition of different stages in life. And again, it may help in preparing people around you within the environment. They're also very useful in order to influence or support health ministry and policymakers. So as I said, the guidelines are a cycle. They have a life cycle. We tend to focus on making them, deciding what we need and making them and putting them out there. We're not so good at the dissemination, implementation, evaluation of them, and then we think a long time before we decide to review them. So it's really, these steps are just as important. And we hope that the patient versions and the translation of the guidelines will also help a lot with the dissemination and implementation of them. I'm delighted that we have, at this Congress, we're going to have the EB Nutrition Constipation Guideline going to be presented by Rosie today, and both Rosie and Lynn are here. Also that the wound care guidelines are going to be presented by Jane and Caroline after me, and that the podiatry guideline is going to be touched on later on this afternoon by Tarek, but also we're having the recommendation meeting on Saturday afternoon, and you can see Tarek and Mark, who are the two leads for that guideline, on that slide. I'd like to acknowledge everyone that's been involved, also the DEBRA bodies that have funded a lot of our guidelines. We also get a lot of support from other DEBRA countries. We have a working group that gives me loads of advice, and that is a good group to go to. And there's additional groups that also are involved in the whole process. So I keep on pressing hard. So these are all the people involved this year, all the panel members, and I'd like to say thank you for all your hard work. Thank you.